Excellencies, ladies and gentlemen, dear civil society colleagues, thank you, Mrs. Chair, for the opportunity to make a statement in the panel. My name is Eliza Kurcevic. I represent the Eurasian Harm Reduction Association. EHRA is a regional network of 300 organizational and individual members from 28 countries of Central and Eastern Europe and Central Asia, working together to ensure the rights and freedoms, health and well-being of people who use psychoactive substances. Developments in digital interconnectivity played a significant role in the changing drug markets and how they work. Over the past 10 years, our understanding of how drug markets operate in the ECA region have changed, and the development of information technology has led to a proliferation of new ways to access drugs online. As it is shown in the World Drug Report 2021, over a 7-year period, number of people who use purchasing drugs tripled. Within the ECA region, the most popular online spaces to sell and buy drugs are messenger applications, Telegram, VA, Polvik, Vkontakte, and market spaces, Hydra, Union, Legalizer, Psylab. Through the years, Darknet also became a space to access support and to share life-saving information in the safety of online chat rooms and discussion forums for people who use drugs who are harshly criminalized in many ECA countries. In addition to this, peer support, for some, it can be an entry point to health services, bridging the barriers between people who use drugs and professionals. Online forums create the possibility to engage specialists, doctors, nurses, social workers, harm reduction workers with health-related questions without meeting them in person. Within ECA, Darknet drug markets empower the creation of safe spaces by consumers, sellers, and service providers to engage with each other. The anonymity provided by the platforms as well as the unique nature of the markets themselves create an important opportunity for providing peer support and sharing harm reduction information in places where it is otherwise repressed by the state. There are a few examples how harm reduction services can be provided through the Darknet and why it is crucial to ensure that health service providers can provide their services without a persecution. Firstly, reporting dangerous substances to vendors. Darknet drug markets provide a non-judgmental and anonymous environment in which buyers can share their experiences without fear or stigmatization. For consumers, these markets enable people who use drugs to evaluate the quality and potency of substances bought online through the rating systems and inform other customers of potentially dangerous substances. In online markets, drug sellers are interested in building trust with their customers, while customers are interested in making informed decisions about what they purchase. Despite the risk that a substance might contain adulterants that are potentially dangerous, or might have a higher potency than expected, because reviews are typically subjective opinion of the customer, the review system still provides useful information to customers, allowing them to adjust their use or moderate their dosing based on peer experiences and feedback, which can help reduce overdose. In a conventional drug market, giving feedback to a seller is possible, but very unlikely to happen. Secondly, sharing living experience in the Darknet discussion forums. Almost all Darknet platforms provide chat rooms or discussion forums where customers can anonymously share knowledge and experiences, ask questions, and feel connected to a virtual community that shares similar interests. This platform therefore provides a safer space for users who are otherwise isolated from mainstream services due to stigma and concerns over identifying themselves as a drug user. Despite the positive user-driven side of the forums, in most cases people are sharing personal experiences and subjective information. Therefore, to facilitate evidence-based information and provide an entry point for support services, peers working in the harm reduction organizations in the ECA region became involved in the forums. Trained peers participate in discussions and provide evidence-based information on harm reduction or treatment. Based on the needs identified by forum participants, peers can also create a new content. This activity not only provides accurate information to forum participants about harm reduction, but can also create contact with so-called harder-to-reach groups. This process is also called web outreach, online outreach, netreach work. Exchanging peer knowledge and experience in the Darknet and building connection and trust can benefit not only to individuals, but also enable harm reduction services to access isolated users and extend harm reduction services into virtual platforms. Furtherly bridging the gaps between peers and professionals, many studies have found that people who use drugs who experience stigmatizing incidents in the healthcare settings will be less likely to access services in the future. There are also countries in which evidence-based health services for people who use drugs are simply not available, and those programs that are available are unattractive or stigmatizing. In response, many people who use drugs seek to access alternative, non-judgmental environments for information or support. Darknet forums become a place where people can engage with others on drug use issues without prejudice or stigma. The involvement of professionals in darknet forums is not only an opportunity to save lives and assist consumers to inform decisions, especially about the wounds, overdose, poisoning, mental health issues. It also offers a way to build connection and trust in the online environment and, if needed, to support person in real life. However, unlike support assessed in a healthcare setting, providing support in a darknet discussion forum reaches people who use drugs in their own private environment. This can not only make access to information faster and more anonymous, it also allows professionals to reach out to contact with otherwise isolated and harder to reach populations. However, to keep harm reduction workers safe, agreements with governmental institutions should ensure that health service providers and peers can safely provide information and support for people who use drugs in the darknet platforms. Initially conceived as a novel approach of selling illegal drugs, darknet drug markets are slowly becoming a place where global online drug cultures are discussed and where individuals develop a sense of belonging to community they could not find in the real life. Darknet markets can also be used as a platform to provide harm reduction services and connecting with harder to reach populations by reporting dangerous substances to vendors, sharing living experiences in the darknet discussion forums, seeking out health information from professionals, and extending the provision of information into provision of drug paraphernalia. Thank you for your consideration and opportunity to speak.